TV News, expanding your view.
Thanks for staying the course on Cold Digest this Saturday. Of course, we're talking about the Ebola virus, and as relatives of victims cry out. I'm being joined again by Alfred Uwheraka. He's a social affairs analyst. Alfred, thank you very much for staying the course.
Thank you
on
very
the
much.
show today, Siji Akinsoyinu is a legal practitioner. You're welcome once again. The WHO is saying that the scale of the Ebola outbreak appears to be vastly underestimated, even as the death toll now reaches 1,069. You made it clear earlier in your opening remarks that it seems that the fear of Ebola seems to be more than the virus itself. Would you affirm that, even as the WHO is saying that it's being underestimated in the West African region?
Yes, exactly, because we don't know the extent of which the virus is spreading. One, two, victims, that's relatives of the victims who have died from Ebola virus, are being stigmatized. People don't want to go near them or even touch them or have any contact with them because of the same fear of the virus. Now, you've already heard news of what the virus can do, how you can contact the virus. By the time you interpret that to your brain, you say, oh, if I shake somebody's hand, I can get the virus. If I embrace somebody, I can get the virus. If I come in contact with the fluids, the excreta, the sweat, the catarrh, or any body fluid, the urine of such a person, I can get the virus. Now, that means that what that interprets in 100% is that don't go near that person or anything or anybody in contact with that person. And from what we've discovered from the embassy in US, in Nigeria, they said that it is only when somebody is critically ill that you can contact the virus from that person, from his fluids. But if the person is not critically ill, you can't contact the virus. But you know the Nigerian factor. Once you hear something, whatever is said after that, nobody is concerned. Now, WHO has said that the extent of the virus is underestimated because you don't know the limits and power of this virus. This is not HIV or AIDS, where if maybe you can still shake the person, you can still talk to the person, you can even sit down, drink from the same cup. The only thing is that you cannot have maybe sexual intercourse with the person. Understand? Because it is through the same fluid you can still get the virus, but it's not as contagious as Ebola. Now, what I want to say in effect is that I mentioned earlier about doctors who will not want to risk their life because of the virus. Nigeria as a whole, apart from Lagos State, Anfred already said it, apart from Lagos State, no other state, even in Ekiti State, they said it there, the Commission of Health said it there, in Ekiti State, no other state has the infrastructure and the equipment to contain this virus. We are hearing stories now that the virus has reached Enugu State. A nurse in Lagos State who was in the first consultant hospital, who contracted the virus through Patrick Sawyer, was told she had the virus, left Lagos State against medical report and concerns, and went to Enugu State with a luxurious bus. Now they are trying to trace all those who were in that luxurious bus, and those she had contact with. They were only able to get 19 persons who are being quarantined now in Enugu State. What does that tell you? What does that picture tell you? It means that the virus is spreading. If those 19 persons, if one of those 19 persons in Enugu State is confirmed to have the virus, it's spreading.
Well, the health minister already established the fact that the nurse couldn't have, infected another person because it took about 10 days before she started showing symptoms. Would you say that Nigerians are getting enough education in this light? Because there seems to be more exaggeration than it is of the knowledge of the virus itself.
I think what is happening to us is like you said, a fear of the unknown. Even WHO, when it came out with that picture, is relying on a level of hygiene. They are speculating on the basis that with the medical situation in those third world countries, we should not take it for granted that it has not done its own spread. So there are people you don't capture. Like now, we don't have a demographic data on everybody around. So the fear WHO is saying is trying to warn us to be a bit more proactive, to do much more, because you can't picture those who have been infected. So they are just casting fears. If I look, the medical situation in these countries is not too good. So to even talk about hygiene, then you now have a scenario where an infectious person is picked up and attended to. But you're not able to capture all those who probably may have been infected because you've been told that it manifests after some days. So if the virus gets into you, in this room, it may not manifest to anybody. All of us are just sitting there. All of a sudden, two will just come as bloom. So I think it's more of the fear. Like I did say earlier, we are lucky that Lagos State took a proactive action. And at the end of the day, that has curtailed it to some extent. We are not too comfortable in saying that much more people have not been infected. In a situation where some of us take to self-help, some, if they have malaria now, they think it's malaria, they go to one native doctor, go to this place. So you don't really know those who are completely infected. Our appeal at this stage is that all state governors, federal institutions, should now put the structure in place right now. Because even if you don't have a patient, let it be there. It will serve other purposes. You even serve the purpose for HIV, you can serve people for other infectious diseases, like even leprosy. It's the same principle you're going to use in quarantining people. So it will be a good thing. Like that, the governor of Lagos State is complaining that they haven't got the money. What I don't like is public show. I would rather he gets in touch or they do it without us in the public getting to know. Because you're creating more fear.
No,
in the minds of people.
he already established that, you know, on the Saturday Vanguard, that what they actually need now isn't much of the money as regards to personnel. And he said that they are getting enough attention from the federal government. So there doesn't seem to be any instigation.
I think I read somewhere where it said of the money voted by the federal government for this, they haven't got a cover. But I know that Lagos has a way of working. Even if they use their money tomorrow, they get refunded. I don't want us to use money now as a point of contact. Like you rightly said, right personnel. This is the time we are making an appeal that there should be a roundtable discussion between medical doctors and these various stakeholders, federal, states. Like the presidency invited all the governors to a roundtable. There will be proper education. I'm sure in 1 week, they should be able to get centers. The centers mean the structures are there. It's just taking a portion of the hospital for the purpose of proper quarantining. So there should be a speed in this. I expect that in the next 1 week, governors should report back they've got it. If they haven't done so, then there's laziness again coming down the steps.
Well, Shide, let's begin to look at the role of foreign aid in all of this. Some have questioned that if the Liberian that brought the virus to Nigeria was an American citizen, why didn't he go to the United States for cure other than rush it down to Nigeria? And in the case of the Western world helping with our problems, it hasn't really worked with Boko Haram. Do you see it working for Ebola?
Yes, because as is where there are rumors going around that there's kind of a Western world conspiracy against African countries where they just want to wipe out or reduce our population. Because as it were now, Nigeria is the most populated black nation in the whole world. Now, I see a situation that I ask myself a question. Number one, Patrick Sawyer knew he was infected. He was told not to travel. He traveled. He didn't go to Ghana. He stopped over at Ghana. He didn't stay in Togo. He didn't stop over in Togo. He came to Nigeria. What they said was that he was coming to attend a conference. That's one lie. Another lie was he was looking for a medical asylum in Nigeria to see whether he can get treated here. Probably maybe his port of call was TB Joshua's church. Fine, that not said. Now, when other countries had this virus, like Sierra Leone, Ghana, Liberia, US had no drug.
You'll be on now.
I stand to be corrected. Mainly Nigeria got the first
Just
reported case.
Just a minute, Barrister. We have a call from Ade. Good morning, Ade.
Hello, good morning, sir.
Ade is calling from Kaduna. Can you hear us?
Yes, I just want to make a contribution related to this issue of Ebola. The doctor there just told me that somebody, a lady from first assistant nurse, that led that was infected and just moved to Enugu. How was she escaped? doctor said he said they quarantined there. So how does the lady escape from a quarantine in Lagos to Enugu?
Well, that's a $1 million question. Thank you for your contribution. It was asking that if she was quarantined in Lagos, how come the nurse found her way to Enugu?
that is the $1 million question.
Just like we'll be asking how the Patrick Sawyer, who was also
exactly our barriers or our checkpoints across each border is porous. Fine. The reason for this is just because we are an ECOWAS country, and ECOWAS countries they open all borders, so I can travel from Nigeria now to Ghana. So a nurse leaving Lagos, fine, she was told she was quarantined, quite right. How was she able to leave the medical facilities? Of course, nobody wants to touch her because the fear, like I said before, the fear of the virus is killing Nigerians than the virus itself. The fear that I will get this virus is what will kill somebody. That not that okay, someone has the virus. That one's a different thing. That you will die from the virus, that's a different thing. But the fear that I will contact this virus, if I even meet, you see Tony across the street, you already ask yourself a question that how am I not sure that Tony has the virus? Now, our security positions concerning the training for medical personnel concerning quarantining people who have the virus is questionable. Fashola already said before, even to wear the dress that will protect yourself from getting virus as a medical personnel.
Just a minute, we have another call from Kaduna. Yemi, good morning. Hello, good morning.
Good morning.
Let's go ahead with your contribution.
Hello, my name is Yomi from Kaduna.
Good to hear from you. Go ahead with your contribution.
All right. I said, how does this Liberian man... Hello?
We can hear you. Go ahead, please.
Hello?
Go ahead with your contribution.
Hello, are you hearing me?
Exactly, yes, we can.
Hello?
I can hear you clearly. Go ahead with your contribution.
My comment is, how does this Liberian man, because we have just seen this thing as a setup, all the way from Liberia, because if you check our map from Sierra Leone, Liberia, then cross away Ghana and some other countries to Nigeria, got to this country as a...
Oh my. Without the distraction, there's a lot of conspiracy stories flying around.
I want to just
should we subscribe to that at this time?
No. Say yes. I will get to that, but to answer his question first, he said that fine. Nigeria is an ECOWAS country. We are members of an ECOWAS. So borders between Nigeria, Togo, Cote d'Ivoire, Ghana, Sierra Leone, Liberia have been opened. You can fly in from those countries, but with this Ebola virus now, I think what they do that fine. They said that the U.S. Embassy said that we should not close our borders because of the fear of the virus. But I think now every country, if President Goodluck Jonathan is listening to me right now, every country, for now, ECOWAS countries should close their borders. Close their borders until this virus is contained and quarantined. Those who have virus are quarantined because the scourge. Thank God, like Anfred has said, that it is Lagos. Lagos is sophisticated enough to handle it to some extent. Imagine somewhere like maybe Kwara or Kano State, for example, crying out loud. Or even Kaduna, as it were. Do they have the facilities? Do they have the medical facilities to tackle this virus? Because it will spread faster than a wildfire.
It's all right. Alfred, all these conspiracy stories, as some are saying that CCTV cameras showed that Patrick Sawyer avoided people at the Liberia airport. Yeah. There are others who said that he was, urinating at health operatives in Nigeria. How do you place all of these with all the stories that are flying around? Okay, just before you answer that, we have another caller from Kano. Good morning. Hello, good morning. Are you there?
Good morning.
Yeah, thank you for joining us, Somto. Go ahead with your contribution, please.
Okay. I heard somebody. Okay, sir. I heard somebody from Kaduna talking of the nurse that traveled from Lagos to Enugu. But according to what the Minister of Health told us, I think that woman was still under surveillance. I think that woman was not yet quarantined then.
Okay.
They told us that the woman was still under surveillance because there was a time they were asked how to monitor all these 100 and something people that they are suspecting. So the Minister of Education clearly told us that they don't have to keep all of them at a place, that some of them, they contact them on phone on daily basis, asking them, how are you, how do you feel, maybe if you have any symptoms, you have to tell us.
It's all right, Somto. Thank you very much for your contribution. I think that he was able to shed some light on that.
I think
somewhat
that's,
under surveillance.
this kind of information is helpful for all of us. You hear that 61 has been asked to go cleared. It means in the world of such emergencies, confusion reigns. Now, on the issue of conspiracy, it is true they seem to give you room to think. I recall when the American government said they were going to use the drugs only on the 2 doctors. It's under experiment level. And then the presidency accepted in America that we take liability. You know, in the drug world, if my drug has not been certified by anybody, I'm liable for it, just like it happened to Nova in Kano area. Now, my worry is what I heard from America that said the Nova Silver we're having now,
Pesticide.
that is a pesticide. The person who developed this in their medical personnel, that area tend to build in the picture of conspiracy. That is a pesticide. I think
Just a minute, we have another caller from Aduekiti. Hello, Jimo.
Good morning, sir.
Please go ahead with your contribution.
I would like to shed some light on what she said.
I just want to contribute to what you are saying.
Go ahead, please.
My advice goes that the government should, the federal government should curtail this Ebola in time so that it will not spread to all the parts of the state.
So that it won't get to Ekiti where you are. Thank you for your contribution, Jima. Good to hear from you.
Well, like I was just saying, you see, if you do a scalar quantity of all these theories, sometimes you think, like my friend did say, that is a conspiracy. You started with the issue of the drugs being applied to Widodo, and they took them away from Liberia. And there was a request that it should be used down here, and they said the drugs are still at the experimental stage. We take responsibility, so we'll not allow it here. All of a sudden, the pharmaceutical company came out and said, yes, FDA has approved that they can be used, but they have only 1,000 specs.
Okay.
So it's limited the quantity. Now that a man was walking behind, I got to know that the gentleman had done this thing. They were going through test run. He needed approval of either FDA or whatever World Health to go ahead. And World Health Organization came out that whatever you can do in your environment to arrest it, please do. So this latest one of Nova Silva is a bit worrisome because that will bring some diplomatic thought process. The doctors that developed this thing, if they were found to be yes or no, it will imply so many things.
So let me just come in here. No. See, the Americans came up with a drug called Zima, right?
Yeah.
Now, the Nigerian government requested for the drug first.
Denied.
We were denied, and it was given to Liberia. Given to Liberia, all of a sudden, Halabulu, they said the Zima drug is finished. Can they manufacture more? Oh, it's because it's given free, right? And they want to make the demand more than the supply so that people can start asking for the drugs.
Abuja. Hello, Chooks.
Somebody has just said that it's conspiracy somewhere, and I agree with him entirely because this is for the 8 years.
David was discovered in Ebola was discovered in 1970. The World Health has never done anything. The whole countries have not done anything. They just stay quiet, and people are dying. Just recently, somebody was brought to Nigeria here, having been told that he has that very.
To what he just said, should
Now,
set from
H2
Abuja.
gene
Now,
content,
the
and
Zima
the another one
drug
is
is finished. Now, somebody produced another drug. You are now dismissing it because it's not produced from your own side as a pesticide. Fine, I'd rather prefer to take a pesticide if I'm infected and get cured than to wait for a
Side
Zima
effect.
drug. Yes!
But
But now let's go back to this issue of Ebola now. He spoke
Okay.
about the history of Ebola. I did a little research on the history of Ebola. Ebola was discovered now DRC Congo, former Zaire, in 1976. What happened was that there were two villages within that region. Is it Kiwisi or I forgot the name of the village? Two villages were wiped out by this virus. The World Health Organization sent some doctors there. They took their blood samples, their semen and their fluids, their different fluids, and then said, where is this virus coming from? So they now found that, okay, in some of these villages or huts, that what do they normally eat? What's their nutrition? Okay, they eat a lot of meat. What kind of meat do they eat? They eat monkeys and they eat bats. And not just any bats, nutritious bats, fruit bats. Now, when they now take some of these bats that were not yet killed, they found out that the bats had the virus. That means the virus comes from these fruit bats, which are the predominant hosts of this virus. Now, where did these bats come from? They went to a particular forest and discovered that these bats were from this forest at night. Now, when they now took the blood samples of these live bats and monkeys, chimpanzees, and they found out that the virus was in these animals. So as they don't know what name to give the virus, and they discovered that after wiping out those two villages, they couldn't actually pinpoint the name for the virus. They now discovered a river
that was named Ebola.
close to that place where those villages were wiped out. It wiped out two villages, and I said, okay, let us name it Ebola virus. That's where the name Ebola came from. Now, after 1976, it was wiped out. Nobody heard anything about it. It was said that a drug was discovered in South Africa in which they used to treat those people and they got better. The virus came back in 1978. In most films that Americans normally shoot, some films they shoot recently in 2000, 2002, and 2003, they deposit a virus called Ebola to be wiping out some people in US and some countries in US. Futuristic films, science fiction films.
We have a caller now. I'll have to hold you for a minute. Hello, Fred.
Hello, thank you.
Let's go ahead with your contribution.
From what I've been listening to this discussion, I understand this Ebola virus will not infect another person until it has begin to show symptoms.
Yes.
Exactly.
In the life of the carrier.
Yes.
This lady that traveled from Lagos to Enugu is still under 21 days, and it has ever been said that it's already showing the symptoms. Then why should we take those people that entered the same bus again should have been affected in one way or the other now?
The minister already dismissed that claim. We heard the minister dismiss that claim earlier. Are you still there, Fred?
No, it's not there.
Okay, but I think that there's a need for, the populace to be more, more deeper clarification in that.
I don't believe the federal government.
The minister came out and said that even people who claim to be primary contacts, to have had contact with that woman, did not contact anything, because up until she started showing symptoms, there was no way she could have infected another person with
I
the virus.
concede to the fact that if you look at the story about the other woman who had a son in Anfred Foundation, I wasn't too lucky. My son from Italy and the family were to come back. They said they were not coming. It was that I had the details. She is connected with the NMPC. And then the child was in First Foundation. And of course, with all that is going on, she decided to go to NLPC clinic, which is their own clinic. That's the story.
Let me cut in there. Sorry to cut in there. One of the nurses who attended to Patrick Sawyer attended to that woman. As at the time Patrick Sawyer had the virus, one of the nurses that attended to Patrick Sawyer attended without protecting herself, without knowing that Patrick Sawyer already started showing symptoms of the virus. He had been vomiting before coming to First Consultant Hospital. Now, he had the virus. The woman attended to without knowing and attended to that woman too. It was now later discovered that the woman gave birth to a child normally. The child was infected with the virus. She had the virus. Family members came to visit her to celebrate her that she had a child. And when she now discovered the symptoms of...
While we take this call. Hello, Chooks.
Hello.
Please go ahead with your contribution now.
Hello.
I can hear you. Go ahead with the contribution.
Hello. Can I do out again now?
Go ahead, please.
Can I speak on yes? Okay. The issue of Ebola, is man-made. It's man-made. It appears that somewhere somebody is sputtering the viruses and releasing them from time to time.
Oh my God. Tell me about it.
Is that all, Chooks?
Recently, it was said. Hello?
Well, with you, go ahead.
Hello?
Go ahead, Chooks.
Recently, it was said. Now, it is Ebola.
It's all right. Looks like
clear.
everybody has a right to use our
I
own
can safely
opinion.
debunk that issue of Ebola being man-made. If it is man-made, the rate at which it's killing people in Liberia, not Nigeria now, in Liberia
And Guinea.
and Syria alone, you won't say it's man-made. It could be spiritual, fine, but it's not man-made. It's not man-made. Because look at the issue of Ebola. Let's cast our mind back to memories. There was SARS. There was bird flu. There was HN15 and some other viruses that came. You can't say those ones were man-made. Because especially the issue of SARS that happened in China, where people had to be wearing face masks to protect their mouth because it was airborne. Now we had other issues. Even after that, we had HIV and AIDS. And we can't say that one is man-made too. Now, we are not talking about science. I'm not a medical personnel or a scientist to say that okay, mutation of some viruses and mutation of the body system and our DNA to know how some viruses evolve. As it stands now, Ebola has no cure.
Well, as we begin to round up now, Alfred, let's consider the changing social life in Africa as we tackle Ebola. Of course, there's a dwindling patronage of bushmeat. You know, people do not shake hands again. Of course, religious worship that, you know, used to engage people. Okay, let's take this call before we round up the show. James Julius is calling from Kaduna. Hello, James.
My contribution is I heard from one. Yes, good morning. I heard from one of the earlier callers that the woman that traveled to Enugu was on surveillance. If somebody is on surveillance, would it have been possible for her to have been allowed out of the radar to travel out of Lagos? And being a medical personnel and somebody that knows the danger that comes from that particular virus, I believe it is unethical and unprofessional for her to have traveled out of Lagos to Enugu, knowing how the virus, how deadly the virus is. And apart from that also, I believe the issue of conspiracy really needs to be looked at. Thank you very much.
Thank you, James, for your contribution. We were talking about changes in social life.
Some period ago, a conference was held of a group of people. They were reviewing even the ECOWAS region. There are going to be a lot of crisis in the economy of the ECOWAS region. For instance, Guinea can no longer export bananas, which was their mainstay. We're talking about shaking of hands. Right here, between both of us here, we hardly patronize small restaurants now. We hardly patronize even the hospitals. People are no longer going to the hospital because their fear is that whatever tools that are there could have been infected. Even when you say the virus cannot stay outside the body, within a short time, like HIV in those days. I think the fear of the unknown, like he keeps saying, is what is causing this panic. And to add to the fact that even if you decide to shut the borders, like he rightly said, the borders are many. And you cannot all be policed. Now, what I discovered in the human character is that in an attempt to prove that he didn't have virus, because he has not seen the proof, he moves across the border. He won't want to go through discerning minds to be checked. He just go. In fact, people are trying to avoid. Why should somebody begin to use infrared to check my body? I'd rather go by land. I've had stories like that. After I land, you just walk across. So we have a challenge. Now, what we have noticed in Nigeria is that, first of all, the hunters are on protests. That nobody comes to eat their meat. And naturally, if we say the animals are carrying the viruses, you will scale down. The places where they use the meat to even cook, because the way the virus works, immediately you have a contact and somebody just takes it. Very easy. Even the people with the attire. Once you touch the serum and you go to maybe rub your nose or something, that's why they ask you to shut down all the systems to make sure they cover everywhere. Because if you enter your eye corridor, the virus, only one virus, as said by a medical doctor yesterday, is enough to cause calamity. So there is panic. When you have panic, the hospitality business goes dead. People are not visiting Nigeria. People are not visiting from other countries because
we're talking about the economic impact.
Yeah, you're talking about the major impact. Now, on health reasons, even talking about the economic impact, locally here.
Just a minute, Alfred. This is our last caller on the show today. Let's hear from Yusuf. Hello, Yusuf. Yusuf, go ahead with your contribution.
About Ebola issue. I am just advising people they should take notice of prevention tips, how to avoid it. And the government, they should tell you the truth, they should tell us the truth about what is going on without hiding it. And my advice also for the doctors, psychologically, it's not good for them to be telling people there's no cure for certain disease. I am talking about regional perspective because we are made to understand there is many disease without cure for it. So the best way for them to tell people is that we are trying our best to find solution for this Ebola virus, so that people have rest of mind, and they should keep on telling them how to do in order to avoid this disease or virus. It's better in that way, because some people have already killed themselves before they catch the virus. You know about the salt issue. Some people put salt in the water and drank it. Some people they were
dehydrated.
And some people were hospitalized, and some people have even died of that because they had this virus has no cure. So psychologically, for my own understanding, and religiously, it's not good for the doctors to tell people who are there's no cure for this disease. I rather should tell them that we are trying our best in order to find solutions for this. But these are what we should do in order to avoid it. And for my own understanding, there's no disease without cure. There is cure for it, but maybe the doctor has not found that for now.
Okay.
But they should tell people the ways that their mind will be at rest.
It's all right.
Thank you.
Thank you very much, Yusuf, for your contribution. Quite optimistic there that there will be a cure. Might not just be coming up. We're rounding up now. Well, of course, we saw Mr. President and some governors and other, leaders, political leaders, show an automatic sanitizer. Many are saying this is the time where the federal government can stand up to give Nigeria some things free. For instance, that automatic sanitizer should be everywhere by now. How do you react to that?
Well, as a medical team, I've confirmed that the sanitizer is not a cure. It's
But
only
it can improve the hygiene.
Yeah, it has helped to improve the hygiene of Nigerians. At the end of the day, we feel that at the end of this episode, Nigerians should begin to take their hygiene a lot more serious. And that is the positive part of it. The health sector will improve.
Okay.
Naturally, it should improve. We believe that it has curtailed a lot of travel. People are beginning to stay in their homes and sanitizing their homes. So it's going to be good, but unfortunately, there will be a lot of losses. A lot of losses that if you quantify it, even the hospitality business is going to a halt. Hospitals are not getting patients. Everybody is doing self-help. They just go to the chemist and take a drug because they didn't make contact with anybody. So the pharmacies are beginning to look like they are not the new doctors on the line.
It's all right. Thank you very much, gentlemen. Shiji, there seems to be more sicknesses killing Nigerians as it is now in Nigeria.
I will say this here. I will say this here because it's not the issue of fine. I said close borders because I said close borders because of what Patrick Sawyer did. Fine, okay. I have a reason for that, but not the issue of don't visit ATMs, don't go to stadiums, don't go to banks, don't go to halls. No, don't do that. Don't spread panic like what the last caller said. Don't spread panic. Fine, we'll get a cure. Like the xenophilia that they talked about, the last drug they spoke, they say it was insecticide. Fine, let us test it on people and see what happens. You understand? They already told us that Z-map is not available anymore. Fine, let us use what we have to get the result we want.
It's all right.
But what our advice is this: Nigerians and those listening to me, let us practice what they call proper hygiene. Apart from washing our hands, understand? Yeah. Even if somebody has malaria, if you see somebody is sick, don't say because of somebody is sick, say that this person has Ebola virus. No, the person may just have ordinary malaria. You just see someone vomiting now. He has Ebola. He may not have Ebola. Sorry, it's not everybody you see sick on the road has Ebola. Don't spread fear.
Unnecessary discrimination
fear and panic. Don't.
Stigmatization.
I have headache. I'm having headache or I'm coughing. Doesn't mean I have Ebola.
I'm afraid I have to stop you there because we are out of time. Siji Akinsoyinu is a legal practitioner, of course, a guest analyst on the show today. Thank you very much for coming. Anfred Uwheraka, a social affairs analyst. Gentlemen, I wish I could shake you, but there's Ebola.
We can see the Ebola.
It's all right. This is where we round up the show. It's indeed trying times for Nigeria. Boko Haram has killed more than 1,067 people that have died now of Ebola virus. So it looks as if we have a bigger virus that the federal government is fighting against. You and I, it's about time that we can show that we're indeed patriotic and give Nigeria hope. Make the hope come alive again. We'll continue this discussion tomorrow. Call Digest 12 p.m. on Sunday. I am Nifemi Oguntoye. Stay tuned for the top of the hour news. Don't go away.
You can now watch Core TV News live from anywhere in the world on our website www.coretvnews.com. Click on Live TV on our website and watch us live.
And welcome to Core TV Primetime Days.
To follow us on Twitter, click on Twitter icon on our website. On Facebook, click on the Facebook and YouTube to see all our previous news production. You can also watch us live on YouTube. Click Core TV, leave a space, then News. Core TV News, a 24-hour news station.